into my patient's room and make sure to provide privacy and introduce myself. Hello, my name's Lizanne. I'm going to be your nurse today. I'm going to be doing a sterile wound dressing change. Can you please tell me your name and date of birth? And I'm just going to check it with the patient's ID. Thank you very much. And are you having any pain today? Okay. I have given the patient pain medicine 30 minutes prior. They have stated that they're not feeling any pain on a 0 to 10 scale. And now I'm just going to elevate the bed. And if my wound was located in the abdomen or something, I would lay my patient flat and put them in the proper position, but because the wound is on the leg, I'm going to be able to access it. So I'm going to perform hand hygiene and don clean gloves. And this part of the procedure is clean because I am removing the wound dressing. It's going to expose the area necessary. And put a chuck down for all of my trash. I'm now going to remove the dressing, making sure to hold back the patient's skin so I do not hurt them as I'm pulling off the tape. And I'm making sure not to touch any of the wound as I am doing this. When I take the dressing off, I'm going to assess it for amount, type, odor, and color. And I'm going to do the same amount, type, odor, and color for the 2 4x4s as well. And then I'm going to take out the packing, making sure not to touch the edges of the wound. And I'm going to note how many there were used to be packed. And I'm going to note the amount, type, odor, and color of the drainage. And this one fell out, but I will still do the same. And I'm now going to measure the wound. I'm going to do so without touching the wound. The wound was previously measured in inches, so I am doing the same. It is 5 inches long and 1.5 inches wide. I'm now going to grab a clean swab. Sterile swab, I'm sorry, to measure the depth of the wound. I'm going to stick it into the deepest part and move my fingers down so that I am even with the edge of the skin. And I'm then measure that, and it is 1 centimeter deep. I'm now assessing the wound, as I was doing while I was measuring the wound, for granulated tissue. For a proper healing, there's no eschar or slaw, and then I will palpate around the edge of the wound for any bogginess, which would mean that there would be undermining of the wound, which I do not feel any. Now, I'm going to prepare for the sterile part of the wound. I've gathered all of my supplies, and I've made sure that my patient is the correct position before getting everything all set. Now, open. Sterile tip. Making sure to do so away from my body. Placing it on the table. And get rid of this bag, as well as the pin. sure to maintain a sterile 1-inch border. And I'm going to lay it. And what is hanging over the edge is now no longer sterile. I made that a note to myself. And now I'm ready to, I'm going to dump all of my supplies onto my sterile field. Making sure to maintain my 1-inch border. And I'm going to place this right over here, making sure not to touch the edges of that and maintaining view of my patient the entire time, as well as my sterile field. If this was a previously opened bottle of sterile saline, I would make sure to check the date and that it was opened and that it was within 24 hours and lip it. But because this is a new bottle, I'm okay. With the label up, I'm going to pour saline. And I am keeping my sterile field in view. I'm now ready to don my sterile gloves. Going to maintain a sterile 1-inch border. Making sure not to cross the 1-inch sterile border of my sterile field. Starting with my non-dominant hand and grabbing the inside of the glove. Gonna insert my hand. And now, making sure not to touch the inside part of the glove, I'm going to put on my dominant hand. And I can now fix the cuff of this glove. Okay. I'm now going to set up all of my supplies, make sure that they're ready. Taking 2 4x4s, spreading them all the way out, putting them in the sterile saline solution to soak. Making it easier for me once I'm ready to pack the wound. Making sure not to let my hand touch the water because then I would no longer be sterile. Once I'm ready, I can grab my sterile swabs. And start to clean my wound. I'm starting on the outer left edge. Switch hands, quick. Outer left hand edge, and as I go down, I am going to twirl and throw, making sure not to touch the outside edge of the wound. I'm going to do the same thing on the right edge of the wound, making sure to twist as I go down. And now I'm cleaning down the center of the wound, making sure not to touch the outer edge, and the entire time I'm maintaining view of my sterile field. Now ready to pack the wound. My right hand is now clean because it is wet. I'm going to pack the wound, making sure not to touch the edges. Again, I'm making sure not to touch the edges of the wound. So I don't want to drag anything into it. And I'm not touching the inside of the wound bed either. Making sure not to touch the outside of the wound. Although that did touch the outside of the wound, I would have started all over again if I was doing this for real. Okay. Now that my packing is placed, I'm all set with that. And I am going to place my 2 4x4s on the wound. I'm doing so with my left hand, because my right hand is now clean. And then I'm able to place my ABD pad on top of this. And I'm just gonna put gloves. And as I moved to grab the gloves, I kept an eye on my patient. And I no longer need my sterile field, so it's okay that it was out of sight. Now going to tape this on a piece of tape with a pen. I would write my name, date, time, and initials. Well, initials and name are the same. And this tape would like to work. Secure this to my patient. Again, I would put a piece of tape on here stating my name, date, time. Now, clean up. Ask my patient if they're in any pain. Patient reports that they're not in any pain. Return them to a comfortable position. And make sure to put the bed back all the way down so my patient is safe, and that completes my sterile wound dressing.